For the remainder of the course, I'd like you to review these additional PowerPoints for health promotion and clinical practice. These PowerPoints have been uploaded to Advanced 360 as well. And if needed, I could always email you these PowerPoints if you do not have access to them. The three remaining PowerPoints for the course that I'd like you to review would be starting with this one from Hainline, Chapter 8, on immunization and infectious disease. Um, and again, I really want you to focus on this PowerPoint towards the latter part where Hainline goes into immunization and the myths behind immunization as well from the chapter itself. So really, when you study, I want you to focus in on the different myths that are associated with immunizations, looking at the immune system, immunity, herd immunity, and immunization safety. So in the chapter 8, he does a good job on about 2 or 3 pages looking at these myths related to immunization. So the content for the exam will be focused around the myths related to immunization. The other PowerPoint that I would like you to review is in relation to aging, public health, and chiropractic, chapter 14 in Hainline's textbook. And again, here, what I'd like you to do is just focus on um, definitions of the Silmer tsunami, understanding the connection of aging, chiropractic, and public health, defining geriatric education centers, recognizing specific screening instruments for this population, promoting awareness and advocacy, and identifying some resources. So again, the PowerPoint does a nice job of laying out for you these objectives. So again, I'm going to leave that up to you to review. Just know that you are responsible for this for the final exam, and there will be some questions related to this content on the exam as well. And what I probably will do is email you some sample questions related to aging, public health, and chiropractic. And finally, the last PowerPoint is the wrap up PowerPoint for the course itself, looking at specifically, is your office equipped for health promotion and wellness? And you, as a future practitioner, what are you going to do in your office if you claim that you are a wellness or health promotion based provider? So, again, this PowerPoint is on Advanced 360 for you to review. Um, I'm just going to go to a couple of slides here that I kind of want to focus on. Again, looking overall, can we address the leading health indicators as well as, very important, focusing on being patient-centered and maybe creating a checklist of what you need to do in your own practice, educating your staff if you are engaged in health promotion, looking at health risk assessments online or printed within your office. What reminders are you going to have in your chart? Are you going to have in your calendars? Have your CAs give you reminders in regards to specific health risk assessments that you need to conduct on your patients? What handouts are you going to give in your office or brochures from the American Lung Association, Heart Association, American Cancer Association? Quit line numbers. Are you going to connect with a good lab, a good laboratory, so you could send your patients out for blood work? There are free posters online from the CDC. Are you going to have these posters that maybe are gain framed or loss framed communication in your office for your patients? What books are you going to have? Maybe you could have a library in your office that you could sign out content to your patients and then quiz them on that content. So again, what health promotion related issues are you going to address in your office? How do you track your patients and know who is doing what towards a healthy goal? Well, maybe create a chart entry system in your on your electronic health records in your office that will address risk factors, risk status, readiness to change for your patients. And again, you as the physician, what barriers are you going to overcome? Are you going to get trapped in some of these barriers that will prevent you from engaging in health promotion with your patients? Screening, are you going to screen your patients? What screening mechanisms are you going to use in your office? What communities are you serving that have the greatest risks for a particular condition or health related factor that you will screen for? Um, and the last thing that I wanted to briefly talk about was, again, this is just showing you how to flag your patient's chart. And maybe in there you could address certain things or have your CA, your receptionist, flag things for you as cues to action as a practitioner when that patient does come into the office. Here's a good example of flagging your chart regarding tobacco use. And finally, what I wanted to talk about was billing codes. Now, as a practitioner, the ACA has pushed these billing codes, and these are billing codes that are in the ICD-9 manual and the CPT manual, I should say, the CPT manual for coding, and they are under the area of preventative medicine. And as you can see here, these codes range from counseling for risk factors for an individual for 15 minutes, 30 minutes, 45 minutes, and also counseling groups. New in 2008, they added 2 additional billing codes that were specific for smoking cessation counseling based on a particular time increment, 3 to 10 minutes or greater than 10 minutes with your patient. So again, at the end of the day, as chiropractors, we can use these codes when we engage in health promotion counseling with our patients. And the more we use them, the more the insurance companies are going to recognize that as chiropractors, we are truly engaged in preventative medicine, in holistic care, in wellness and health promotion. So I encourage you, as you venture out into your own practices, to maybe start using these codes. So finally, how will you center your practice? Will it be patient-centered? As Thomas A. Edison said, and I quote, "The doctor of the future will give no medicine, but rather will interest his patient in the care of the human frame, in diet, and in the cause of prevention and disease." This brings us to the end of this course. I hope that you've learned a tremendous amount that you can take into your student practices as well as your own practices upon graduation. I will be emailing everybody a blueprint for the lecture exam as well. And please feel free to contact me when I get back into town on Thursday if you have any further questions. Thank you and good luck on all your exams.